This is ADL number 5, elimination. 5A is urinary elimination. We look at that first, and this is on page 16 of the nursing document. So we go to our assessment first. So the patient's maturation, are they continent or incontinent? So tick whichever applies. If the patient is incontinent, indicate the level of incontinence. Is it occasional or intermittent or complete? For complete incontinence, indicate the reason or the pre-existing condition and length of time if known, so you can document that there. So based on pre-existing conditions, is continence, Michigan, incontinence, symptom index, the MISI assessment indicated yes or no? Okay, so if you go down through these questions here, it'll help you decide whether you need to complete the MISI tool or not. Okay, how often do you pass urine? Not applicable if the patient has a device in situ, if they have a catheter in situ. Has the patient's usual pattern changed? Yes, no, or not applicable, and you can specify there. Does the patient have a history of recurrent UTI? Yes or no. Okay, so these questions here, if the patient answers yes to any of these questions, then you need to complete the Michigan Incontinence Symptom Index on page 17. Do you leak urine when you cough, sneeze, run, laugh, move suddenly, etc.? So yes, no, not applicable, and you specify there. Do you suffer any other urinary problems, for example, retention, urgency, dysuria or nocturia? Yes, no, or not applicable, so you specify there. So if the patient has answered yes to any of these, then we will complete the MISI assessment, and this is on the next page, page 17. So this is it here, okay. So the first section of this is stress urinary incontinence. We look at this first, okay? So you ask the patient these questions and they answer either never, rarely, occasionally, about half the time, most or all of the time, and then you tick whichever one and they get a score accordingly, okay? So during the last month, how often has urine leakage occurred in association with any physical activity? That is lifting, bending, exercising, etc. Okay, so you tick whichever one applies and you put your score here. How often has lifting light objects, 10 kg or less, caused you to leak urine? Again, you tick your score. How often has walking or light exercise caused you to leak urine? And you tick your score. So you put your total score here. If the total score for stress urinary incontinence is 3 or above, inform medical team and activate Care Plan 5A. And then we go down to the next section, which is our urgency urinary incontinence assessment. So how often have you leaked urine because you could not wait to empty your bladder? You tick whichever one applies. How often has a sudden urge to urinate caused you to leak urine? You tick whichever one applies. And how often have you leaked urine because you could not reach the bathroom on time? And again, you tick whichever one applies. You add up your scores and put your total score here. If total score for urgency urinary incontinence is 5 or above, inform the medical team and activate Care Plan 5A. The next section is pad use. On average, what form of protection do you use to protect against wetness during the day? So none, a score of 0. Thin pad or tissue is a score of 1. Medium or regular pad is a score of 2. Large or maxi pad is a score of 3. And absorbent disposable undergarments is a score of 4. Okay, so you can document your score there. Pad use, then the next part of that, on average, how many of these protective measures would you use to protect against wetness during the day? So none is a score of 0. 1 per day or less for security is a score of 1. 1 per day and it is usually wet is a score of 2. 2 to 3 per day is a score of 3, and 4 or more per day is a score of 4. So you can put in your score there. This next section is the bother score. So overall, how often have you needed to change your daily activities because of your urinary incontinence? So never, a score of 0, rarely, a score of 1, sometimes a score of 2, most of the time a score of 3, all of the time a score of 4. And overall, how big of a social problem, anxiety or embarrassment has your urinary incontinence been for you during the past month? So no problem, score of 0, very small problem, a score of 1, small problem, score of 2, moderate problem, score of 3, and big problem, score of 4. So then your total score for this whole assessment, you add up your stress urinary incontinence score, your urgency urinary incontinence score, your pad use score, and your bother score, and that'll give you your total score. If total score for all domains is 7 or greater, medical team informed, and you can tick the box there to say you've informed the medical team. Activate Care Plan 5A, so tick the box to say that you've activated Care Plan 5A, and we'll look at that in a minute. And if the person is 65 or older, refer to the clinical nurse specialist care of the older person, and you tick the box there to say that you've done that. And then whoever has completed the assessment will sign there and date and time of assessment. Okay, so we go back up to our urinary elimination assessment. So this is back to page 16. Okay. So does the patient require assistance with toileting? Yes or no, and you can document your comment there. Urinalysis, you can document the result of the patient's urinalysis there and any comment you want to add there. The patient's BHCG, is it negative or positive? So you tick that, and then this is the signature of the person who has taken out the pregnancy test and the date that it has been taken out. Okay. So we will go over to Care Plan 5A. The patient has altered urinary elimination. Expected outcome remains dry and comfortable, and continence is promoted as appropriate. Patient passing adequate amounts of urine. So the nursing interventions, this first one we have all highlighted in yellow. Assess voiding pattern daily, record report abnormalities. So we activate this for every patient. Record urinalysis, assess appearance and characteristics of urine. Inform team of Missy score as per assessment. Okay. Refer to clinical nurse specialist of older people as per Missy assessment. Monitor accurate intake and output. Maintain adequate hydration and reduce evening intake of fluids. Promote healthy bowel function. If patient is incontinent, wash skin with a pH 5.5 cleanser. Do not leave plastic or disposable sheet underneath patient. Provide bedpan, commode, urinal assistance to bathroom as needed. Obtain MSU, CSU. Toilet patient, whatever amount hourly. It could be 4 hourly, it could be 2 hourly, whatever it is. Ensure toileting support is in place, particularly post-administration of diuretics. Implement a day and night toileting regime for patients with incontinence problems, and you can document what their day regime is there, how many hours, and nighttime regime there as well. Request review of patient medications. Liaise with physiotherapists to optimise continence management. Liaise with OT to ensure appropriate toilet aids are used. So you activate whichever interventions are relevant for your individual patients, and if you want to put in more individualised interventions, you can document them here. Now the next part of this is if your patient has a catheter. So we go back to the assessment here. So this is actually all part, this is your catheter care bundle. Okay, so it is within this assessment and care plan. So it is so important that this is completed for any patient who has a catheter. So we document there, is it a urinary catheter or suprapubic urinary catheter? So we tick whichever one applies, and has a CSU been obtained. So the reason for urinary catheter, so we should be documenting this, okay? The date inserted, the type of catheter, the size of catheter, and the batch number. So if the patient has a catheter, then we have to activate all these interventions. So assess urinary catheter need, and if not required, discuss removal with the team. And if the catheter is removed, we can document the date there. Perform catheter care daily, ensuring the 5 moments of hand hygiene are performed before and after care of the urinary catheter. Ensure PPE is worn. Empty drainage bag on each shift using a clean container. Patient aware of his or her role in minimising risk of developing urinary tract infection. Ensure meatal hygiene is performed daily by a patient or healthcare worker. Check the catheter has been continuously connected to the drainage system and the drainage bag is positioned below the level of the bed or chair with no kinks in the tubing. So they all need to be activated. Now, if the patient's catheter is removed, then we can resolve these problems here. Okay, so you sign and you initial in the resolve box. Okay, so we'll just scroll down. That's your MISI assessment. And now we're going on to the next part of elimination, which is on page 18. And this is 5B elimination. This is the patient's bowel assessment. Okay, so again, we go to the assessment first. Has the patient a history of bowel disease? Okay, so you tick any of these that apply. IBS, Crohn's, colitis, diverticular disease, or maybe there's something else and you can document that there. What is the patient's bowel habits? What are their usual pattern? How often do their bowels move? Is the patient continent? Are they incontinent? When was their last bowel motion? And what was the Bristol stool type? Has the patient got a stoma? Yes or no, and what type of stoma? Any problems? Is the patient constipated? Have they diarrhea? Are they incontinent? Are they in pain? Do they pass blood or mucus? Are they on opioids or any other problems? And specify there and give details of that. How do they manage these problems at home? Does the patient have a history of diarrhea in the last 24 to 48 hours? So yes or no. And if yes, the number of episodes. Does the patient have a history of vomiting in the last 24 to 48 hours? Yes or no. And if yes, the number of episodes. And then down here you have your Bristol stool chart as a reference tool. Okay. So we will go back to the care plan 5B. The patient has an altered bowel function and the expected outcome is to ensure optimal bowel pattern is maintained. The first intervention here, we need to activate this for all patients. Observe stool pattern, record frequency, character and volume daily as per Bristol stool chart. Record and report any abnormalities. So the rest of the interventions, obtain stool specimen for, so you can document, is it for C. diff or whatever it's for, you can activate that. These 2 interventions in bold. If patient has greater than 3 episodes of diarrhea or vomiting or both in 24 hours, request isolation. And if patient has suspected or confirmed C. diff, please complete the C. diff checklist. And that's down on the next page and I'll go through that shortly. Encourage high fibre diet, fluids and increased mobility. Administer antidiarrheal laxatives as prescribed and document effectiveness. Monitor intake and output. Refer to dietitian if required. And then you have spaces here to write in your own interventions to make this individual for your patient. The next care plan then is if your patient has a stoma, we can activate this. So 5C, the patient has a stoma. The expected outcome is the patient's stoma is healthy. So our nursing interventions, assess the appearance of stoma, liaise with stoma or colorectal CNS, monitor intake and output appropriate to the type of stoma, maintain intact peristomal skin, promote patient independence with stoma care, assist with hygiene and toileting as required, ensure provision of education and support, For newly formed stomas, liaise with stoma or colorectal CNS and complete stoma assessment and care form. And again, we have our blank spaces here to write in your own interventions that you can activate. So down on page 19 then is our C. diff checklist. Okay, so you just need to complete this once if you have a patient who has been diagnosed with C. diff. So it gives you advice on how to look after the patient with C. diff. So patient must be isolated. All patients with C. difficile infection require isolation in a single room with hand wash and sink and or ensuite facilities, a designated toilet or commode. They are not permitted to use the ward general toilet facilities. If on treatment, they should be 48 hours post-treatment and symptom-free before isolation precautions are removed. Ensure doors are closed. Document stool use in the Bristol stool chart. Alert medical staff to review patients' antibiotic regimen and stop inappropriate antibiotics. Ensure all healthcare workers perform hand hygiene with liquid soap and water immediately after removal of PPE and as per 5 moments. None of the agents used in antiseptic hand wash or antiseptic hand rub preparations are reliable sporicidal against C. difficile. The physical action of rubbing and rinsing is the only way to remove spores from hands. Advise patient to carry out hand hygiene. Remove gloves and wash hands immediately after contact with any infective material, before touching non-contaminated items and environmental surfaces, before leaving the patient's environment, before moment 2, for example, administration of IV medication. Remove apron or gown immediately after contact with any infective material, before leaving the patient's environment, wash hands with soap and water. Ensure the immediate environment and all patient care equipment of patients with C. diff infection is cleaned and disinfected. Ensure the bedpan washer is in working order. Bedpans or commode utensils avoid any contact with any surfaces, that is curtains, door handles, during the transport of the contaminated bedpan or commode utensils. Bedpan or commode utensils should be placed directly into the washer or disinfector and not placed temporarily on any surfaces. To achieve adequate disinfection, staff should ensure that bedpan washes heat to a minimum of 80 degrees Celsius and maintain that temperature for 1 minute. Ensure that all commodes, including those in the isolation or cohort facilities, are cleaned and decontaminated as per manufacturer's instructions and allow 5 minutes contact time after each use. Tag the clean commode. Equipment ought to be designated for individual patient use. If reusable, clean and decontaminate between use. Ensure all patients who require assistance with a hoist have a dedicated sling. It must either be single patient use or decontaminated and laundry before use on another patient and as required. Ensure all soiled or damaged mattresses are removed. Ensure pressure relieving mattresses are being sent for decontamination after each use. Ensure chairs and pressure relieving equipment are removed if damaged or soiled. Advise restriction of unnecessary patient movement. Staff ought to inform receiving department, facility, hospital if transfer is from an outbreak area. Medical team to inform patient of C. diff. Ensure to communicate infection status to affected patients and community. Ensure information sticker is placed in medical notes and the patient receives a patient information leaflet, and all necessary equipment and clutter to be removed.